Hey guys, Dr. Bodle here. And the second I start talking about going gluten-free to help out with your Hashimoto's symptoms, people immediately start asking me about testing for celiac disease. So in today's video, I wanted to cover the connection between Hashimoto's and celiac, why testing for celiac disease isn't always as clear as we want it to be, and what my recommendations are when it comes to going gluten-free and helping to support your thyroid symptoms. As always, if you like this kind of stuff and enjoy learning about natural strategies to help improve your Hashimoto's and hypothyroid symptoms, please remember to like, subscribe, and click on the bell for notifications. I post videos every Thursday morning, and that'll let you know when new content is available. Now, we've discussed before about how autoimmune conditions can cluster in families and how different autoimmune conditions can tend to cluster within an individual. The reason for this, and one of the big reasons why autoimmunity can develop in the first place, is because these individuals have a genetic predisposition to changes or abnormalities in the way that their immune system works. This is also why, and although this isn't the case for everybody, it's fairly common for patients to come into my clinic and say, yeah, I've been struggling with thyroid issues, but my mom also has thyroid issues, my aunt has thyroid issues, my grandmother has thyroid issues. Is this something that maybe can run in the family? And the answer is yes, and that's because of that genetic predisposition. Your family is all susceptible to similar sorts of conditions, and that goes for everyone, by the way, but the condition is going to look different from family to family. And with enough of an environmental push or environmental stress, we can start to see those genetic abnormalities manifest and develop into symptoms. But not only do you and your mother share a similar genetic makeup, but when we look at the genes that can contribute to Hashimoto's and celiac disease, there is a huge overlap. Now, this doesn't mean that everyone with Hashimoto's has celiac disease, and on the flip side, not everyone with celiac disease has Hashimoto's. But we do know, as we said, the genetic makeup is similar, the mechanism behind these pathologies is similar, and based on meta-analyses, if we look at people who are diagnosed with one condition or the other, they have a higher likelihood of being diagnosed with the second condition. So while it's certainly not a slam dunk or a scenario where A always equals B, there is a significant amount of evidence that these two conditions have a connection. So if you've watched my content before, you know that I think utilizing a gluten-free diet can be a big lever for us when it comes to managing autoimmunity. However, I think the general thinking around gluten-free diets can be a little bit different, and it often can lead people down the wrong path. And here's what I mean by that. Because of the way it's often portrayed, you might be thinking, you know what? I'm not sure if my body does its best when I have gluten. And when you get online and Google it, the common recommendations is for you to get a test for celiac disease. The thought process here is, if you get testing for celiac and it is positive, then you need to avoid gluten. But if you get celiac testing and it's negative, then it's okay for you to have it. But here's the problem. The presence of celiac disease is not a defining metric for whether you should have gluten or not. Now, I know that might be a little confusing, but this is a super important point for us to understand. Celiac disease is just one manifestation of our body negatively reacting to gluten. And although it's one of the more common manifestations, it's one of the ones that is more well known, it isn't the only one. It would be kind of like saying everyone who goes to college and gets a degree gets a biology degree. Of course, we know that's not true, and there's a lot of degrees that people can get. The classwork and education that you receive can manifest and specialize in a bunch of different ways. And just because you go to college doesn't mean that you're learning the same things as some of your classmates. Just like going to college can allow you to attain many different degrees, reacting to gluten can affect many different parts of the body. And celiac is just one of those reactions. So is it important to know whether you have celiac disease or not? Yes. But if you don't have it, that doesn't mean that you're not reacting to gluten in other ways. So check this out. There is a whole category of conditions referred to as gluten-related disorders, and it is described as a spectrum of diverse clinical manifestations triggered by the ingestion of gluten in genetically susceptible individuals. Now you'll notice that nothing in that definition specifically called out damage to the small intestine, which is one of the diagnostic features of celiac disease. It said the clinical manifestations are diverse, and those manifestations include pathologies that are both intestinal and extraintestinal in nature, meaning that they can happen both in our gut and elsewhere. The research in this area goes on to detail something called gluten ataxia. And this is something that you might not be familiar with at all and is something that you might not deal with at all, but I think it makes a great example for us. Gluten ataxia is one of the most common neurological manifestations of gluten-related disorders. And it occurs when our body reacts to gluten, we develop antibodies that then damage the cerebellum in our brain. This damage then leads to changes and symptoms associated with gait, balance, and coordination. But here's the kicker, only 40% of people with gluten ataxia have evidence of small intestine inflammation. That means for the majority of these patients, if they were to do a duodenal biopsy, the gold standard for diagnosing celiac, it would come back as negative. Yet, the main treatment for gluten ataxia is strict adherence to a gluten-free diet. So the key take-home point here is this. In cases of gluten ataxia, where we know the treatment is a gluten-free diet, if we were to only rely on celiac disease as the indicator of whether or not we should adopt that gluten-free diet, it could be super misleading for most people in this situation. Again, that's because we can have many different types of reactions to gluten, and celiac disease is just one of them, and it doesn't tell us whether we're having reactions in other parts of our body. Gluten ataxia is just one of these, and I think it does a good job of highlighting it because the research shows that only 40% have both gluten ataxia and the findings present on biopsy that would indicate celiac disease. So if we take that knowledge and understanding, it makes sense that we can extrapolate it to these other areas, one of which being the potential reaction that we can have with gluten and the way it impacts our thyroid. Now, because I've mentioned it a few times, I did want to talk a little bit more about testing for celiac disease and also draw your attention to another area that can be a little bit problematic with this. Now these days, it's fairly common for people to be diagnosed with celiac disease via a blood test. And the marker that gets checked is something called tissue transglutaminase antibodies. Transglutaminase is a protein that is found in our gut, among other places, and antibody reactivity to it can lead to damage of our small intestine. It's estimated that about 93% of people who are eating a diet that contains gluten and have positive tissue transglutaminase antibodies have celiac disease. However, if you're not eating gluten, or if the condition is so chronic that the ability of your immune system to respond has become suppressed, then this type of testing can give you a false negative. In those situations, the best way to identify celiac disease is through endoscopy and biopsy. While biopsy is the gold standard, it's not perfect. Celiac disease can affect the small intestine in a patchy and non-uniform manner, and because of that, different tissue samples are going to show different levels of disruption. Once multiple samples can be aggregated, then a grading scale is applied to them. This grading scale looks at the amount of white blood cell infiltration into the gut lining, the amount of crypt hyperplasia, and how much the villi, or those little finger-like projections in our small intestine, have atrophied. The lesser of these findings, the lower on the grading scale you are, and the less likely that you have celiac disease. And of course, the opposite is true, where when more of these findings are present, it's more likely that celiac disease is something that you're dealing with. And the thing that I often think about when it comes to this grading scale is something that I've mentioned in the past. We usually think about someone having a disease or not having a disease. But when it comes to autoimmunity, it is something that progresses over time. And while these types of grading scales can help us to track that progression, it doesn't always give us the full clinical picture, and it doesn't always directly correlate with the amount of symptoms that we're experiencing. So I know we just went over a bunch of information to make the point that celiac disease doesn't tell us whether we should have gluten or not. But I think we can all agree that if we do have celiac disease, then gluten is definitely something that's more on our radar and something that we need to avoid. But what if you have all the makings of celiac disease, but you don't meet the diagnostic criteria yet? You're on your way, you're not feeling well, you're reacting when you eat those kinds of foods, but you just haven't checked all those boxes for the clinical diagnosis. Something to think about, right? So my issue is that, and the point that I'm trying to make in hopefully a decent way, is that an individual might not fit into that perfect box of a diagnosis, but that doesn't mean that we should ignore our understanding of the progression of the disease, the mechanism behind it, and how they're feeling and functioning. So even though we know that reactions to gluten can cause symptoms in parts of our body outside of our small intestine, we also need to be aware that gluten reactions in our gut can still be a problem for us, but we might just be in those early stages. So not only is celiac only one manifestation of gluten sensitivity, but the severity of that reaction makes a difference. And the degree to which that affects our testing should only be a piece of the decision-making process in our strategies moving forward. So finally, what are my recommendations when it comes to eating gluten and Hashimoto's, and what are some of the things that you should be aware of as you track your progress? First of all, because of the genetic similarities between celiac disease and Hashimoto's, and also the evidence that we see clinically, I do think adopting a gluten-free diet can be very beneficial for people with thyroid autoimmunity. In addition, for people with chronic symptoms who have only had partial relief with going gluten-free, I highly recommend going grain-free because of some of the similarities between the proteins in gluten-containing grains and gluten-free grains. Oftentimes, using both of these strategies in tandem can help us to improve and take that next step. If you've already gone gluten-free and grain-free and you're not noticing much of a change, then there's a few other things that you'll want to consider. You may want to review your nutrition plan and look for potential exposures to gluten that you might not be aware of. Remember, even some foods that are listed as gluten-free can still contain a small amount of gluten in them. The threshold is less than 20 parts per million, and that's not because people can't react to less than 20 parts per million. It's because that's the amount that can be reliably tested in a laboratory. In addition to reacting to small amounts of gluten or other grains, it's also possible that you could be reacting to other types of foods. And in some cases, those other foods could be causing a more severe reaction than gluten itself. So we always want to be aware of all of the potential big food triggers and not get too focused on gluten itself. Next, remember that although food is important, it isn't the only thing that can trigger our immune system. So we might be doing a great job with going gluten-free. But if we aren't managing something like the chronic stress we're being exposed to, then that could be the thing that is inflaming us, holding us back, and preventing us from really seeing the benefits of changing our nutrition. And finally, although gluten might have a negative impact on your body and how you feel, the decision of whether or not you avoid it completely is always up to you. I have another video that goes into all of the details and strategies on this topic, and I'll link it for you in the cards. But my goal always is for you and for my patients is for you to understand how your body feels and how it responds. Once you have those tools in place, you can make the decisions that are best for you and helps you to achieve your individual goals. But I hope that this video was useful to you, and I hope that it helps to highlight some of those areas that can often be confusing and get people mixed up. If you have any questions, leave me a comment down below and let me know what you think about the gluten-free diet and how it affects and impacts Hashimoto's and related symptoms. If you liked the video but know that you need more individualized help and would like to work with me one-on-one either in person or virtually, then you can send me an email at contact@seattlethyroidhelp.com. I always start with a free consultation to make sure that all of your questions are answered, we understand what your goals are, and that we're a good fit to work together. If you're someone who feels like you're not being heard by your doctor, your symptoms are continuing to progress and they're not being addressed, and you know that there are other options out there, you just don't know what they are, then I really encourage you to reach out. If you'd rather work on some things on your own, that's okay. I won't be hurt by it. You can check out any of my other videos on the channel, whether it's Hashimoto's or thyroid in general, or you can grab either one of my free downloads listed in the description box, one of which is the dietary recommendations that I use for many of my patients with Hashimoto's and autoimmunity, and the other is the electrolyte strategy that I use for people using a ketogenic or low-carb diet. But that is all for today. I love and appreciate you guys so much, and I hope that this information continues to be valuable to you. If you liked the video, please remember to like and subscribe. And if you're looking for more information, you can follow me on Instagram or Facebook, where I post daily tips and strategies. But my name is Dr. Bodle. I hope that you guys have a great rest of your week, and I will see you in the next one.